Hello everyone, this is Dr. Liliana Andrade and today's topic is dementia and cognitive impairment. So let's get started. Dementia and cognitive impairment are among the most common and challenging conditions in geriatric medicine. As healthcare professionals, understanding the nuances of these disorders is crucial for early diagnosis, effective management, and improving patient outcomes. Dementia is not a single disease but a syndrome caused by various brain disorders leading to cognitive decline severe enough to impact daily life. According to the World Health Organization, over 55 million people worldwide live with dementia, and this number is expected to nearly double by 2050. Aging is the greatest risk factor, but is not a normal part of aging. In the United States alone, nearly 6.7 million people have Alzheimer's disease, the most common cause of dementia. With an aging population, the burden on families and healthcare systems continues to grow. That's why recognizing dementia early and implementing appropriate interventions is so important. Dementia can be caused by various underlying conditions, and the type of dementia often determines the progression and treatment options. Let's break it down. Alzheimer's disease accounts for 60 to 80% of cases. It is characterized by amyloid plaque formation and tau tangles, leading to neuronal death and brain volume loss. Memory loss is usually the first sign, followed by difficulty with problem solving, language, and eventually basic self-care like difficulty with activity of daily living and instrumental activities of daily living. Vascular dementia is the second most common type, caused by reduced blood perfusion to the brain due to strokes or chronic small vessel disease. Symptoms vary based on the area of the brain affected, but often includes difficulties with problem solving, slow thinking, and trouble with focus rather than early memory loss. Lewy body dementia is characterized by abnormal protein deposition called Lewy bodies. Symptoms include fluctuating cognition, visual hallucinations, sleep disturbances, and Parkinsonian motor symptoms. It can be confused with Parkinson's disease dementia. Frontotemporal dementia affects the frontal and temporal lobes, leading to significant personality and behavioral changes, including impulsivity and difficulty with language. It tends to occur early than other dementias, often before age 65. Other causes include Parkinson's disease, progressive supranuclear palsy, normal pressure hydrocephalus, Huntington's disease, traumatic brain injuries, infections like HIV or syphilis, and metabolic disorders. If you want to hear more about this, just leave your comment below. Diagnosing dementia requires a thorough evaluation, as many reversible conditions such as depression, vitamin deficiencies, or thyroid disorders can mimic cognitive impairment. Here's the standard approach. Obtain a detailed history from both the patient and a reliable informant to assess the onset and progression of symptoms. Ask about functional impairment, if they're having any struggling with finances, medications, or daily routines. For diagnostic tools, we have the Mini-Mental State Examination, a 30-point test assessing different cognitive domains like orientation, memory, attention, language, and visual spatial ability. However, it has a licensing fee, which makes it less accessible. But don't worry, we have the Montreal Cognitive Assessment, the MoCA, which is very comprehensive and more sensitive for detecting early cognitive impairment. Brain MRI or CT scan helps rule out structural causes like strokes or tumors. For blood tests, check for B12 deficiency, thyroid function, and metabolic abnormalities. CSF biomarkers and PET scans are useful in specialized cases, particularly for distinguishing Alzheimer's disease from other dementias. While there is no cure for most types of dementia, management focuses on slowing progression, symptoms relief, and improving quality of life. Cholinesterase inhibitors like donepezil, rivastigmine, and galantamine help boost acetylcholine levels in Alzheimer's and Lewy body dementia, improving cognition in some of the patients. Namenda or memantine, an NMDA receptor antagonist, is used in moderate to severe Alzheimer's disease to regulate glutamate and reduce neuronal damage. Newer treatments like anti-amyloid monoclonal antibodies like lecanemab and aducanumab target amyloid plaques but requires careful patient selection and monitoring for side effects like cerebral edema. Non-pharmacological interventions like cognitive and behavioral therapy help patients maintain function longer. Structured routines and environmental modifications like reducing clutter, labeling items, and simplifying tasks help prevent confusion. Physical activity and social engagement like regular exercise and social interactions have been shown to slow cognitive decline. Don't forget about caregiver support. Dementia care is emotionally and physically demanding. Providing education and respite care for caregivers is crucial. New evidence also suggests that multi-domain lifestyle interventions such as the finger study, combining diet, exercise, cognitive training, and vascular risk management, may delay cognitive decline in at-risk individuals. I will leave the link for the finger study in the description box. While we can prevent all cases of dementia, research suggests that modifying certain risk factors can significantly lower the risk. Key recommendations include controlling hypertension, diabetes, and cholesterol to prevent vascular damage. Also engaging in regular physical activity to support brain health. Following a Mediterranean or DASH diet, rich in antioxidants and omega-3s. Prioritizing mental stimulation through lifelong learning and social activities. And ensuring quality sleep to reduce neuroinflammation and amyloid buildup. Public health initiatives focusing on these factors may help reduce dementia rates over time. Dementia is complex, but with early detection and a holistic approach to management, we can make a real difference in the lives of our patients and their families. If you found this video helpful, please like it, subscribe, and share it with your friends.